Right now, though, we do want to focus on your concerns over rising COVID cases here in Connecticut. The state's positivity rate today at 3.35%. And many of you have been sending your questions to us. Joining me now to help answer them, Dr. Scott Roberts, Associate Medical Director of Infection Prevention at Yale New Haven Health. Dr. Roberts, thanks so much for being with us.
Thanks for having me, Erin.
So obviously a lot of concerns with this Delta variant. I want to start with this question from Susan from Wallingford. She says, I had COVID in April 2020. I got the Pfizer vaccine in April 2021. Do I have better immunity having had the virus and also having had the vaccine?
Susan, that is a great question, and most likely yes, although a lot of this is currently being studied. What we do know is that it's certainly not dangerous, and it may actually be helpful in terms of revving up the immune system even more. In some diseases, vaccines can actually lead to greater immunity than a natural infection. And with COVID, this really remains a key question.
All right, Linda from Manchester has the next question for us, and she has a lot about the flu season. Do we get flu shots as we usually do? And will there be any interaction problems with the COVID shot? We're kind of nearing in the next couple of months, doctor, that key time period of getting our flu shot.
Yeah, we're actively preparing for a more regular flu season this winter, and I expect as life returns to normal in some areas when masking and social distancing goes away, we'll see a return in flu numbers greater this year than last year for sure. We are still recommending everybody get the flu vaccine this fall, and there is no concern for interactions with either the COVID vaccines or COVID treatments.
All right, that is good to know, a good relief for a lot of people out there. Lastly, Linda from Winchester, she wants to know, is there a test for the COVID variant? How do you know if it's Delta or not?
Great question. Unfortunately, these require specialized tests that look at the genetic makeup of the virus, and they aren't used in routine testing settings. Here, one of our public health labs evaluated COVID tests from the community, and over the past several weeks, about 3/4 of the viruses were found to be the Delta variant.
All right, good to know. Dr. Scott Roberts with Yale New Haven Health, thank you so much for answering those great questions from our viewers. We appreciate it.